All right. Well, welcome to today's webinar. We are going to talk today about the 2024 HIPAA security updates that have been released from HHS. But we're going to start off with some of the most common security risk assessment findings, particularly those from the past few years. And I'm Amy Daley from the Kentucky Regional Extension Center from out of Lexington, Kentucky. And I will be joined today by my friends over at CISA, Ryan Lewis and Colin Glover. I like to call these guys my cybersecurity experts. They are the coordinators here in the Kentucky region for CISA. And before I jump in and start talking about the findings of security risk assessments and all things HIPAA security compliance, Ryan and Colin, I'd love for you guys to just introduce yourselves quickly and tell us a little bit about CISA, what your mission over at CISA is, and what kind of things you all are doing here in Kentucky locally. Colin, would you like to go first?
Sure, and thanks, Amy. Thanks for having us today. Just a real
Absolutely.
quick overview. CISA has been around for about 5 years. We come out of the U.S. Department of Homeland Security, and really our goal is to be left of boom. That's kind of a military term. Right of boom means you're after the incident. Left of the boom means you're before the incident. When a critical infrastructure member has a cybersecurity incident or a physical security incident, the FBI, the Secret Service, law enforcement is going to be engaged in the investigation. That's really not our role, although we can certainly play there. Really, we want to help on the preparation and prevention side. We don't want organizations to have an incident, and that's really where we focus, in helping critical infrastructure identify vulnerabilities and implementing remediations so that they don't have that incident, or if they do have an incident, that they can recover quickly. And Ryan, I'll let you add on there.
All right, thanks, Colin. I appreciate that. And Amy, yeah, definitely, we appreciate you inviting us to the webinar this afternoon. As Colin was said, we kind of just go out and kind of, do things left to boom, trying to educate the state of Kentucky or anything with any other organization within Region 4 on some of the services we have that they can use to increase their cyber posture, and just kind of looking at how better ways to maybe do some asset inventories or tabletop exercises to understand who to communicate when in the event there is an incident where it happened.
That's great. And we are going to talk about some of those strategies. The objective of this presentation today is to, I, as the HIPAA security advisor, want to share with our audience the types of things that I see when I'm conducting security risk assessments each year, and how those vulnerabilities, those high risk findings are directly correlating to what we're seeing in the cybersecurity world and the threats that we're seeing in healthcare today. And what we know and has been proven, and we've read in report after report, is that our top threats still today in 2024 continue to be cybersecurity attacks, specifically those known for our social engineering attacks and ransomware attacks. And so as I go out and conduct the HIPAA security risk assessment, which is associated with the HIPAA security rule, I have, over the past 3 to 4 years, been deliberately looking more strictly at those parts of the healthcare organization's compliance program and the safeguards specifically related to where I think the biggest weaknesses are. This is just a glance at the HIPAA security rule, the 10,000-foot view. These are all of the safeguards that, as a covered entity, you're supposed to have in place: administrative, physical, and technical. And this rule, as you know, we're about 20 years old with this rule at this point, and not a lot of change has taken place. But there has definitely been a lot of change when it comes to what our biggest threats are. And they're hitting us on the technical side more so than anything. And so I'm really looking at specific safeguards associated with the security rule and tying those back to where I think we're getting hit the hardest. And so just stepping into this, I've kind of listed out the top 5 findings that I have assessed very strictly, and these are high risk vulnerabilities that I'm finding, that I'm, putting on nearly all of my clients' SRA reports, and have been for the last, well, since 2021. This is something that is each one of these are showing up as high risk, sometimes medium, depending on what they have in place, but as high risk findings. And it's not so much that they don't have a policy written around it. They may have a policy written in place, but then when we go to actually review the actual process and what we're doing as far as our day-to-day operations in relation to the security management process as a whole, we need to strengthen. We need to be doing more in those areas, and maybe we need better documentation. We need better processes. So I want to step through each one of these and kind of just explain the process for when I'm on site and I'm reviewing these safeguards. I do want to point out here at the bottom of this slide, OCR has recently released a report, and within it, I actually copied this straight out of the report, and they say there is a continued need for regulated entities, those are the covered entities, all healthcare organizations, to improve compliance within the HIPAA rules. In particular, the security rule standards and implementation specifications of risk analysis, risk management, information system activity review, audit controls, response and reporting, and person or entity authentication, which I found very interesting because when I was putting this presentation together, I already had identified that these are the top 5 that I'm seeing on each of my reports, and it went hand in hand with what OCR, who's the governing body over HIPAA security, says that they too are seeing in their breach investigations. So that alone makes this presentation hopefully very helpful. It's very useful information, and you'll be able to walk away with some strategies to help you within your organization. The first one being the security management process. So the cornerstone of the HIPAA security rule is the security management process. It is conducting your risk analysis. And then from there, how do you manage the risk that is identified in that analysis? Mitigation strategy. The clients that I work with are conducting their risk assessments, and they do have a risk management team in play, and they are taking the reports now more than ever and doing something with them, not just saying, okay, well, we're done because we had our assessment. It's what comes after the assessment that is so important. It's what's identified in the assessment. So that you'll know where your weaknesses are and begin to strengthen those. But the one thing that continues to pop up during these assessments is a lack of information system activity review. So, I would love to ask you guys, and this by definition means regularly reviewing records and audit logs, access reports, security incident tracking reports. What kind of information can you guys give me from like what you see in the field of, where do you see organizations doing this well? What type of review processes do they have in place? And any recommendations that you all have, what can you share with me? Colin, do you want to go first?
Yeah, for sure. And I think Ryan had to step away for a minute, so I'll cover him until he can get back.
No problem.
One of the issues at large is particularly when you're trying to review logs. Trying to review logs manually is nearly impossible. If you have an extremely small environment, you might be able to get away with it, but in general, you're going to have to go to some level of automated tools. Many places I go, especially on the small and mid, they may have logs enabled at their firewall. Obviously, they're going to have logs like via their Windows devices, via Event Viewer, and then cloud logs as well. The ones that do it well can get that to a single pane of glass. The ones that struggle, they are doing it disparate, and they're really only reviewing the logs in the event of trouble or an incident. That's not great. You're not going to be able to see that, and typically you're going to have to spend a lot of time going through those logs to identify the suspicious or anomalous activity. But it's hard. Setting up a good logging environment or a good logging system is difficult. There's no easy way to do it. That being said, and Amy, I'm going to try to share my screen if that's okay.
Yes, please do.
And let's see. Let me know when you can see it.
Yep, I think you're good.
Awesome. So several years ago, this actually came out of the British National Cybersecurity Center, and then CISA took it over. It's called Logging Made Easy. It's for an Active Directory environment. It's built on an ELK stack, Elastic Log Cabana. What's that L stand for? I forget. But it's a very powerful tool. It does not replace a full-featured SIEM by any stretch of the imagination, but it can be very helpful, particularly in a Windows Active Directory environment. It's completely no cost. We have the fact sheet and frequently asked questions. You can download the tool off of our GitHub site, and it's easy to get up and running. What's nice about it is it has some of the filters already pre-built, and certainly can help you set up a centralized log repository and begin that analysis. In conjunction with that, if you're using cloud environments, in particular, things like Microsoft 365 or Google's Workspace, is we have some baselines already built out for establishing actual visibility into the environment, and then configuring your 365 or Google Workspace to operate those securely. And in conjunction with that, which is super nice, I'll see if this will work, is again on our GitHub site, there's a pre-built assessment tool that'll look at a 365 environment or a Google Workspace environment and compare it against our best practices. So instead of having to figure it out on your own, a lot of this stuff is already pre-built. And looking at the logging within 365 or Google or other cloud environments is absolutely critical, and trying to understand what your users are doing and or how an attacker could get their way through that. So both of these tools, or all of these tools, are available off the CISA GitHub site, and there's a number of other tools out there that they can take advantage of at no cost.
Yeah.
If you don't have anything else already in place, it's a good way to get started.
Right. Thanks for sharing those. Those are great resources, and I have no doubt we'll have some viewers who will be navigating out to that site, checking those tools out. Very good stuff.
Yeah.
Let me see if I can get back to my PowerPoint presentation. All right. And you can see that on your
I can
side.
see it.
Perfect.
I sure can.
Perfect. Well, thanks for sharing that, because I mean, like you said, that is something that I hear is, these audit logs are cumbersome. They're huge files. How do you get through those? How are you supposed to monitor those? And it's good to have some resources that can help maybe make that a little less painful.
Yeah, and to be honest, when you set up, something like a SIEM, a security information event management system, it takes a while to get it to work. Most of these aren't going to be plug and play, and you got to take your time tuning them. If you're just getting started with this kind of thing, don't give up on it. It does take time, and certainly there's plenty of resources out there to at least guide you through the process.
Right. Good to know. All right. The second one on my list directly ties back to contingency planning. So when it comes to the HIPAA safeguard for contingency plan, there's 5 main components that make up a contingency plan. Every good contingency plan should have a data backup plan written out. It should have a disaster recovery plan. It should have emergency mode operations plan, testing and revision procedures, and application data criticality analysis. And I do see I've seen over the years that our contingency planning is getting better, our documentation is getting better, but the one thing that I think we struggle with the most, and I assess the hardest on when it comes to the contingency plan, is that part for testing and revision. You know, I do think there is a direct correlation to the significance of the ransomware attacks that we've read about for the past several years. You know, the how hard they've hit our healthcare organizations, tying back to not having a good process or a good procedure in place for testing and revising. So not only are we talking about testing and revising our contingency plan in general, but it's testing and revising our data backup plan, testing and revising our restoration procedures, testing and revising our cybersecurity incident response plans. So, you know, this is a big one, and it takes a team to be able to perform these types of testing and revision procedures. But Colin, I know that you have some helpful tips when it comes to, you know, pointing us in the right direction for doing some testing and revision procedures. And I would love for you to share what you guys do and how you guys advise on this.
Sure. So the biggest one, and kind of the widest lift, in my opinion, although it can get pretty complex pretty quickly, is doing those incident response tabletops. They are absolutely critical. We recommend doing them at least annually, if not more frequently. The huge advantage of them is it gets everybody in the room and you talk through what are responsibilities, who's going to respond to what, and what's expected of everybody when they actually do a tabletop. You know, Amy, you've sat through a couple of ours, I think.
Yes.
We have a number of scenarios already pre-built. We can custom design a scenario for folks. And we even have the National Cyber Exercise Team that provide tabletop exercise from soup to nuts. You know, they design it, they facilitate it, they even do the after action report. Really, really good program, and just one of those critical things you can do. Going back to some of the more technical sides of it is, you know, when you're doing backups, when you're doing contingency plan testing, is understanding, and I think you mentioned about data criticality, is understanding what those important systems are for your network. And you had mentioned earlier, you know, as folks move to the cloud, that makes life a lot easier. But one, they need to look at their service level agreements and hold their providers accountable for that. If the SLA says the vendor is going to perform data backups, actually having that conversation with them to ensure that they're being done. But
Exactly.
also, as you mentioned, and you mentioned earlier, is if an environment has on-premise Active Directory, and that's absolutely critical to the system, ensuring that's being backed up and testing those backups, you know, however you define your backup testing procedures to be. There's a lot of flexibility and a lot of room there on how you want to do it, but having that defined procedure and then actually testing that defined procedure is absolutely critical.
Right. And we did have an offline conversation for a little while before I actually started recording this webinar.
Yeah.
But what you're referring to, we did talk about, you know, I know that most of my clients now are working with EHRs that are cloud-based. And so, you know, the bulk of their EPHI lives in a cloud via their EHR. And so I do get asked, you know, well, our data, our patient data, the majority, it's living in our EHR. So we have a vendor for that. And so what are we supposed to do? How are we supposed to know if they're testing backup? So, you know, I say, remember, they are your business associate. And as such, they are required to the same, to oblige by the same standards and requirements of the HIPAA security rules. So they should be doing their own data backup testing. And so what I advise is you reach out to your EHR vendor and you ask them for not only, so you ask them for what's their data backup methodology? What is their testing and revision procedures for testing that data on your behalf, where does that data reside? So, a cloud really is not the little white cloud in the sky that holds the data. This data lives on servers, and they all have redundancy. So you may have your
Hmm.
data living on a server somewhere in Ohio, another one somewhere in Texas, and maybe even a tertiary somewhere in California, which is great. But they should be, and I would expect that they are testing those backups somewhat periodically. But we need to know that, because as the covered entity, we have to have that information, and we need to put that in our documentation. And that is documentation that every EHR vendor should be willing to share with their vendors or with their clients. So just reach out to the EHR vendor and ask for their backup methodologies. When's the last time they've tested, and you need to keep that documentation in your tracking, along with your business associate tracking systems. So yeah, I think we're on the same page with a lot of that. And it's good to know, kind of, like you said, the tabletops. I think those have been very beneficial with the clients that I've sat in with you guys on. There's always good
Hmm.
feedback that comes from that. And you had showed me earlier, I share the link to your all's website for those tabletops, because those are documents that they can print down and bring to the tabletop exercise. And I know that you guys also will accompany and lead those tabletops on site if a client reaches out and needs your assistance as well, right?
Absolutely. Yeah, whether it's one of the standard ones we have off of our website, or if they want something a little bit more customized, happy to work with them on that, and we'll actually facilitate it for them. Really, we just need people to show up and a place to do it at. We try to make it as simple as possible for the partner to go through the tabletop.
Right. And then to the other point where it came from our earlier conversation, you brought up that I'd mentioned, it's not just your EHR data. So I know that what gets said to me a lot during a security risk assessment is, well, if our systems go down, everything's, we have an outage, or our systems go down, our vendor, our EHR is third party, it is cloud based, so we can just bring it back up. Well, if you get hit by ransomware and you can't even get the keyboard to work on your computer and get through the door to connect to the internet, to then connect to your EHR, then what good is that going to do you? You've got to be able to access. And so that starts with your operating system. That starts with your Active Directory. So there are other parts that probably live on site in your organization that, also, every part of your network needs to be backed up, and those are all made up of files somewhere and systems somewhere. So not just your EHR has to be backed up and tested. Every living part of your network should be categorized and backed up and tested. So
Yeah, I mean,
yeah, go ahead.
yeah. So a couple of years ago, and you can find it off of HHS's briefing website if you want. I think it was the Health Service Executive of Ireland. This is 2022, I think, or 2021. And they had a really bad ransomware attack. What they found, and from what I understand, the ransomware actors actually gave them the decryption key back. I think that's what happened. But it took them a long time just to understand what critical applications had to come back online first. They spent a long time just trying to understand how their organization operated after they got hit by ransomware. So understanding what those critical applications are today, so that you can restore and can come back online quickly in accordance with your business priorities, is kind of that planning process that needs to happen now and not wait until after a major incident.
Exactly. And I'll say this, and then we'll move on to the next one. The data criticality analysis part of it is something that shows up in many of the reports as well. Because quite frankly, I don't see it. It's not written. It
Mm-hmm.
hasn't been reviewed. It hasn't been discussed as part of a response team strategy. I think the common mistake that I see is with data criticality is and I say this I worked in IT for a long time, and I know that we know our systems, right? We know in
Hmm.
the back of our mind, and we've got it figured out. If this happens, then this is how I'll bring it back up, because I touch this and I work with this all day, every day. But what I've seen in these major ransomware attacks is the way that we think it's going to go, it has never gone according to the plan in our head. So we didn't have that, in those cases, data criticality had not been done, testing and revision had not been done, backups had not been tested. And we had been floating by thinking all these years that if the worst case happens, I'm prepared. But
Hmm.
it wasn't until it happened that they found out they really weren't prepared. So that's
For
why
sure.
that's why I'm saying we're going to start back at policy, and then we're going to write the policy. We're going to make sure all the pertinent information is in there, and then we're going to test it. So I think you've given some good advice and kind of guidance on how to approach, because this is not something that's easy either. It takes time and planning just to to plan the plan. But I think that's good advice. And those tabletops, I know you do have those available on CISA's website. I'll
Yep.
move to the next one. And this kind of leads us into security incident procedures. So for as long as the HIPAA security rule has been out, we have always been expected as covered entities to have a security incident response and reporting plan. And, in the past, I would see maybe a document that had been titled security incident report. And it was something that would be filled out, if something like maybe a laptop had been stolen, or maybe a virus had been found on a computer. And so we log those, and that's all still very important things that we need to be doing, because those are security incidents. But due to cybersecurity attacks, social engineering, and then of course the ransomware attacks that we're seeing, it takes security incident to a whole new level. And it's beyond just filling out a form and tucking it away somewhere, because usually we can't just fix it in a matter of a day or a couple hours. And so what I've seen, well, first, as an advisor, what I'm doing is I'm saying we have to, even though the HIPAA security rule isn't written in a way to where it says you've got to have a cybersecurity response plan, I'm tying back the need for a cybersecurity incident response plan to this security incident procedures standard in the HIPAA security rule. And I'm assessing it against that. And I've been saying on the road, I really think we need to have um, a template, a playbook, which is what you guys call it. And I'll go out and you all have shared some templates with me that I have shared, and I've shared at conferences. But starting with that written plan for what happens next once you get that phone call, my computers aren't working and no one on the floor can get logged in, that dreadful call that we've heard about so many times. All right, what's the playbook? What's the first action, And so I'd like for you to talk a little bit about what are the resources out there for planning a cybersecurity incident response and recovery, and maybe some of the playbooks that you guys have shared. Tell me what you know about planning the cybersecurity incident response.
And if it's okay, I'll share my screen again.
Yes, I would love that.
All right. Can you see it?
I am trying to see it. I'm going to stop sharing my screen. There you are. Okay. Yes, I can see it. Go ahead.
Well, good deal. So one of the cooler things that we've done, it says over the past couple of years, and particularly over the past year or so, is they've put together a lot of no-cost training on doing incident response. All of these webinars, or not all of them, but the majority of these webinars are available on demand, from introduction to log management, we were talking about that earlier, defending against ransomware attacks. So all real good videos that anybody can sit through and watch. Most of them are actually available on our on YouTube. You can just go to YouTube and find these videos. You can Google CISA incident response videos or whatever you want to search on the internet, but it's all right there and can walk you through that. That being said, coming up in just a couple of weeks, I think, is using the CISA incident response playbook at your organization. So you mentioned we have playbooks already. It's a template that's out there. They're going to provide live training just next week, it looks like, on using our incident response playbook. They're going to have ranges. It's going to be a good live training.
Wonderful.
And then a couple weeks after that is implementing, instrumenting the environment to detect suspicious and malicious activity. So again, going back to that logging and sensing capability, some real live training on that. So both of those are coming up. One's next week and one is in 2 weeks. I literally just learned about this today. So sometimes I'm behind.
So will those be recorded, Colin, for those of our audience who may not see this webinar until after that live training takes place? Will they be able to come back to your website and see the playback of that?
So the cyber range ones, no. That being said, most of the webinars are. So for instance, a breakdown of the incident response playbook is available on YouTube.
Okay.
So they're trying to hang most of these on YouTube at this point. I have not seen many of the range ones hung up on YouTube yet, and that's something we can go back and ask for. But all the awareness ones are being hung on YouTube.
Right.
Also,
and are the range ones more technical in nature?
They are.
Okay, so that would be more of your
Well,
IT team that would be maybe look out for future live trainings to sign up for.
Yeah. And I should do a better job of sending that out, to be honest. And let's see if I can get there real quick. We also have this website, and there's quite a bit of stuff on the back end for government employees, but just for the public, all of these courses are available off of FedVTE.
Okay, can
So
you
don't
go
wake
back
up to a
and
ransomware attack.
show me that link again so that our audience can see how you got
Yeah,
to
sorry. So under the awareness webinars, so either the YouTube channel, Protect Your Network, or the federal virtual training environment.
Okay, great.
And so, yeah, like I said, these are public courses, no login required. One, cloud computing security, cloud security, cyber supply chain risk management. So talking about all your vendors, suppliers, contractors, that's a good place to look at. Cyber essentials, foundations of cybersecurity, all really, really good courses and a great place to start if you're just learning about cybersecurity.
These are great videos. Yeah, and that cyber supply chain risk management, that's something that's going to become more relevant as these new HIPAA, these new security updates that are rolling out this year as being one of the future cybersecurity performance goals. So that's good to know you all got some content out there surrounding that already.
Yeah, for sure. And
Great.
then one more avenue I wanted to hit on is as you're developing an incident management plan or you have an existing incident management plan, we actually have an incident management review assessment. It's available off of our CSET tool, which is available on GitHub. And this incident management assessment or incident management review assessment looks at how you as an organization conduct incident management. Really not, technically focused at incident response, but how do you manage an incident across your organization? Really, really good assessment. You can take your plan, kind of go through this incident management review and understand how you compare against best practices.
Okay. So that's a good tool that you could, once you have the plans in place and you've tested them, then maybe come back as a follow-up and do the IMR.
And again, really, you can take the IMR and kind of build your plan from it as well.
Okay. Okay, that's good. That's something that I need to look into as well. That might make the planning process go a little bit smoother. I could see how that would, yeah. All right. That's a good link I need to put in my library. Okay. I think you
as
have
you
to
mentioned,
go back.
when we're
Go ahead.
when we're talking offline, there's an infinite number of resources out there. But hopefully we'll find some ones that might help.
Oh yeah, definitely. And I think that's coming up on my next slide here. I just have to go back and
Well, I'm going to stop.
screen share.
I'm going to stop sharing then.
Go ahead, and I'm going to share my screen again. Can you see it on your end for this?
I can see it on my end.
Yeah. Well, so I had this slide in here to just kind of make the point from the security incident planning. You know, I think you'll agree with me when I say, you know, I think there, again, I could talk about direct correlations between the HIPAA safeguards and then what we're seeing, you know, the outcomes of these attacks. And I read this publication earlier this year, the Health Industry Cybersecurity Practices from the 2023 edition, Managing Threats and Protecting Patients. You know, they say in the report that healthcare has the highest average time to identify and contain a breach. And so that average time to respond and contain the breach, just from the 2022 and 2023 incidents, the ransomware attacks, was 329 days. That's the average response time to identify and contain a breach. And that's crazy. You know, that's basically almost a year that it's taking. And so when I have discussions with our clients, and that's why I talk so much about the planning, you know, and the testing and the revision, but specifically having a incident response plan in place. And so that's specifically why I assess that so hard, and pretty much everybody has high risk across the board on that, because this is a new concept, writing these playbooks. But I do believe that they will go a long way. Having those playbooks and testing those and doing the tabletop exercises will go a long way when it comes to awareness, prior to you know, your organization getting hit by ransomware. I mean, and then again, on the resources, you're right, we talked about this prior to the webinar starting, but there are so many resources on how to put together these incident response plans. You guys have some great ones. I love the playbooks. You know, when I first started looking at those a couple years ago, the one that I was sending out to clients was the power company. I think it's the electric utility playbook that you all had. And I would say, you know, whether you're healthcare or whatever industry, that playbook really just guides you along how to set it up. It doesn't matter that it's for the power companies. And so I had some clients who took that as a blueprint and put together their own. But since then, you know, there are some healthcare ones out there, and I've listed 4 different resources here from, there's a new cybersecurity risk management NIST playbook out there, the cybersecurity resource guide that was released in, I think, February of this year. And then there is the you all have the security incident and vulnerability response playbooks. This link takes you to a list of those playbooks I think you just showed us a minute ago. And then if anyone's, the ones who are watching, you may want to take a screenshot of this or write these links down, and reach out to me or to Colin and Ryan. We can point you in the right direction. We have templates we can send you. We have links we can send you. But just getting started is the most important part. And you'll find that as you put this plan together and as you bring your teams together and test it, you will revise it and it will get better and stronger, you know, over the months and years to come. But it just needs to become part of that overall security management process and helping you be better prepared.
And testing it.
Mm-hmm.
And that's where those tabletops come in.
Yep,
You know,
testing it is a big part.
Yeah, I mean, obviously pulling that plan together is absolutely critical, but if you're not testing it, it's not going to do you much good.
Right. I stress that so much, and I know what it's like to be on their side. The testing part of it can be daunting. It can be daunting, but that's where you need a team. So put that team together, reach out, get the help, and And I have seen lots of improvement, by the way, over the past year. I'm already on the road doing assessments this year. I'm so happy to see several clients already. They've got at least a start on these playbooks on their own plans. And now they're wanting to reach out to you guys and do some tabletops and do some internal testing. And so good things are happening, and it really is exciting.
Awesome.
And yeah, I haven't really got to tell you a whole lot about that, but there are good things. Okay, and this brings me to the next very important part of all of this. We know that ransomware and these cyber attacks are our number one threat, but our biggest vulnerability is our people. It's our workforce. It's the human factor. And so every cybersecurity expert that I've ever spoken to says that the way to mitigate this, because it will always be a risk. There will always be risk when it comes to the day-to-day operations and using our technology and our computers. But the mitigation factor there is, training. And so the HIPAA security rule says that we have to have a security awareness and training program. And so, what that comes down to is the what, the how, and the when do we train? What do we train on, and how do we do it? How do we deliver the training, and when do we train? Well, every organization I work for has a new hire program, then they have an annual training program, and then you also are supposed to have what's called ongoing security reminders. And I see that the new hire and the annual training programs, we have those whipped. We do pretty good. We've got good content in those modules. We're doing some face-to-face training. We've got these annual modules. I have to complete those as a UK employee, and there's HIPAA modules in there. But it's the ongoing part that I think needs to be strengthened. We can't just ride on training our workforce once a year on what ransomware attacks are and what phishing is and what it looks like and what social engineering is. They get more and more clever. It's phone calls now. It's not just the emails with the links that you don't need to click on. There are people calling you on the phone and trying to get your login credentials, and they're very smart in how they do it. And able to get the credentials from you over the phone. And remember, that's what they're after. Once they have your login credentials, then they have access to your network. And so how do we prevent that from happening? We have to heighten our awareness program. And so, what do you think, Colin? Or Ryan? I think you're back with us now. What do you guys? I mean, I'm sure you agree that training is an essential part of every security program. I have some slides I'm going to show, just some ideas on what to incorporate for ongoing security reminders. But outside of, what I advise on is maybe not only using email to share. That is the easiest way. But I still have clients who not every member of the organization uses their email account. They're not logging in and looking at email on a daily basis. So if that's your number one means for sharing ongoing security tips, then it's not going to work. If not, all of your workforce is on there. So do you have face-to-face meetings? Do you have newsletters? Do you have an intranet that your workforce looks for? But what tips can you guys give me as far as heightening the security awareness, the tips that go out? Any advice on what to share?
Go ahead, Ryan.
Thanks, Colin. I appreciate it. Hey, Amy, I was highlighting a lot of things you mentioned are great. Just kind of reinforcing those things. I know on CISA's website, and if Colin shows his screen again, there's a series of videos. If you can't meet annually face to face, CISA has a lot of good videos out there that you can send out, and they can go through and look at, looking at ways to prevent or how to identify phishing emails and the thing that Colin and I kind of, I will say preach in this case, kind of since we're out in the States, to let everybody, hey, look, if you're unsure about an email that's coming in and they're asking you to do something that seems a little bit unusual, just pick up the phone. Don't utilize the phone number that's in the email, because that could be the actor's actually going to pick up and tell you, yes, to go ahead and make that kind of make that transfer. Just kind of, pick up the phone, contact unknown user, using a known number, and just kind of reaching out to them, and just doing the things to reinforce and identify some of the things that are happening, and understand that, there are people actively trying to get your accounts and credentials, as you said, and just kind of reinforcing the training through the emails, definitely face to face, looking at some of the videos on CISA's website and a few other things. And Colin, if you had anything to add, please do.
Yeah, and to go with what Ron was saying, I've seen a lot of success with organizations that do like regular quarterly lunch and learns. Cyber may not be at every quarter, but I was working with a specific company, and they had monthly safety meetings, and they would talk about, physical security, physical safety, but would often bring in cybersecurity. And that really helped just continue to reinforce it. People get so overwhelmed with emails, people get so overwhelmed with everything else that they may not pay attention.
Right.
Doing those regular security updates, hopefully in person, or at least at a, staff, a branch level or office level, and just having that communication. As Ryan mentioned, and you mentioned, it may not just be a phishing email. It may be a phone call. It may be a text message. QR phishing, quishing is now a thing. MFA fatigue is real. And encouraging everybody to be suspicious, maybe be a little bit paranoid, and be very cautious about anything that's coming in that you don't expect. I recently got phished. It was in the phishing email was in response to an email I had sent. One of my colleagues, their email inbox had been compromised. They used that to send me a phishing email. Again, it was in response to an email I'd sent. It had a malicious attachment. Spotting that, was pretty hard, but fortunately I saw that the response was to an email I'd sent over a year ago.
Oh.
So it didn't make sense. You have to be paranoid. You have to go, why am I receiving this? Is it legit? And the other side, as dangerous as ransomware is, we see a lot of fraud that goes on. It's a vendor changing an account number. It's an employee requesting their bank account number changed on their direct deposit. Picking up the phone and calling a trusted contact is absolutely paramount in this. And it really takes only a phone call to stop that type of attack.
Right. Right. So, and those are the conversations that I have. It's, making sure you've got the content in that annual training program, but annually isn't enough. So come up with some creative ways to get in front of your staff. Don't just rely on emails, because again, like I said, not every client that I work with has a workforce who even uses their email. And so, but I do, most of my clients do still have those staff engagements once a month or quarterly. And those are great times during staff meetings to incorporate. I say just come up with a 3-minute cybersecurity topic. And the ones that really go the farthest is examples, like pull up stories, pull up links to articles, and share with them, and describing how it happened, what the aftermath was, and how it could have been prevented, and that sort of thing. So it's what I assess on is how often are you doing it? And once a year or twice a year is high risk to me. So it's got to be ongoing. I prefer something monthly, and that's usually what I write in the reports. But I wanted to share, HHS has a relatively new website, 405D, Knowledge on Demand. Well, they have the HHS 405D website. This is one that everyone who's watching this webinar, you need to go out and bookmark, because this is a newer website, kind of launched as a part of this initiative that's coming down for cybersecurity, the cybersecurity resources that HHS has put out. And on this website, they have a knowledge on demand corner here, or I guess page, and they have some new modules that are called 5 threats, 5 top threats, and these are training modules, that cybersecurity training modules that hit on social engineering, ransomware, loss or theft of equipment or data, insider militia data loss, and attacks against network connected medical devices. So each of these modules you are able to save these modules and upload them into your LMS of choice. So you can assign these out just like you do your annual training modules. I think that these are something that everyone should be looking into as part of their security awareness and training program. They're quick modules. They're very they're eye-catching, user-friendly, I guess you could say. Like they encourage you to kind of really want to pay attention. You don't really want to like zone out while you're watching them. They'll hold your attention, but easy to use and upload. And again, you'll find that if you go to Google and you type in HHS 405D, you'll find their website. And they have other training content on there as well. I don't have screenshots of it, but they release posters. So like they have recently a social engineering poster, which is a one-pager that you can print out, or you can share the graphic online, like maybe your intranet site or in an email. You could print them out and post them in the break rooms. They have one on ransomware and more recently one on social engineering. So check websites like that for training resources as well, because the question I get asked is, what should I be sending and how often? And so, look for content that you can kind of wrap up in a security tips type of delivery mechanism, like through the email, through the newsletters, during the staff engagements. And if you need help with that, reach out to me and I can point you in the right direction there too to get more content. And by the way, once you go through that series of 5 modules, you actually have, if you choose to distribute this out to your workforce, a completion. So it's kind of like you took a little cybersecurity program, and I thought that was pretty cool. And then this brings us to our last on my list. So information access management, and this is a big one. So what I run into a lot, especially at my larger clients in the hospitals, is vendor management. So we have so many external vendors, third parties, business associates who have access to our network. And not only just vendors, but it's students, it's auditors, it can be PRN employees. So they may leave for 6 months, but then they come back. So, what do you do with that account? Do you leave it active? Are you leaving it active? And so what I'm looking for is these active accounts are not being audited periodically. So someone may have terminated, even a vendor, but yet they're still active on our network. They still have access. The access has not been disabled. Reconciling vendor accounts against an active user list somehow, that proves to be challenging when you're a hospital who has over 700, 800 external accounts. Maybe you have a control on that where after 90 or 120 days of inactivity, it disables the account. But then my question back to my client is, do you really want to give them 90 days, 120 days, or leave that account accessible for a hacker to come in and gain credentials to? And I still see things like we're sharing our login credentials. Maybe doctors are sharing their login accounts with students. We're still using generic user IDs, and I always write that up in my assessments. But knowing that, there are some of these things are quite difficult to manage, especially with that vendor management piece of it, and that ends up being a manual kind of tracking thing. How do you guys approach the access management piece of it, and what advice do you have for maybe, tracking that in an easier fashion?
So the vendor portion is really hard. Nobody's going to, there's no bones about that. I think somewhere in here you start talking about the cybersecurity performance goals.
I do. Yeah, that's what's coming up.
Okay.
As far as the new 2024 releases from HHS. It is going to be one of those cybersecurity performance goals, essential.
So I'm sharing my screen. And
Okay.
so this is CISA's cross-sector cybersecurity performance goals. So one of them is revoking credentials for departing employees. And the verbiage, the recommended action from the cybersecurity reforms goals, which is probably going to be similar to the health sector CPGs, is a defined and enforced admin process applied to all departing employees by the day of their departure. And that's really the best practice. There should be, whether they're a vendor or employee, the day that they leave, there should be some process to disable that account.
Yes.
And then going back, and we're talking about supply chain earlier, and it is something that we focus on, is having what those requirements are spelled out in your contract with them. You know, if you have a departing employee from a vendor or a contractor, you know, ideally they would let you know, and that's going to be the best practice. Is there is some requirement that as an employee changes over, especially if they have network access, they inform you and that account is disabled. Now there are tools out there. There's some native tools that can be used. There's third-party vendor tools that can be used to track at when people log in and log off. And then based on the organizations, the healthcare facilities, risk assessment and understanding of risk, how long do you want to leave that account hanging out? And how do you detect inactivity? That's really on them to determine, or it may be on you to determine what that risk profile is. But being able to detect inactive accounts and being able to disable or delete those accounts is absolutely critical. Too often, you can go and find it online all the time, or an account that's been around for years that's inactive is one of the major factors that somebody comes into an environment. So understanding all your accounts and practicing good account management is just one of those things that absolutely need to be done.
Right. Right. It's again, it falls in that category of it's not always easy to do it. And so I do have clients who over the past year have started researching, you know, some tools that help with that. But it is one of my top 5 vulnerabilities that I see, especially the larger organizations, again, that's where the struggle is real. Is the larger you are and the more vendors you have, the harder it is to kind of get control over that. But I think we're on the same page there, and I think that's good advice. And that takes me to, as you mentioned, so those were, you know, we kind of went through those top 5 vulnerabilities that I see over and over. And I think, again, the reason I wanted to share those with the audience today is as it directly ties to what we're seeing with the ransomware attacks and the real damage that it's doing to healthcare organizations. Looking back at what are these safeguards that we need to be strengthening within our organization so that it mitigates when that attack happens to us. You know, we've mitigated to the best of our ability, and our response time is not going to be 329 days because we have really strengthened these safeguards and we've got plans in place and we've tested them. I was excited in December, and then again there was an update in January when HHS released that they are now providing more guidance around cybersecurity, and they released a strategy paper that had 4 main objectives. And very quickly, you know, they mentioned that they are going to publish voluntary cybersecurity performance goals. They are voluntary in the beginning. I'm hoping eventually they will become more requirements. Then they're also going to provide resources to incentivize and implement those organizations that implement these cybersecurity practices. I don't know quite yet what that's going to look like, but they do mention hospitals being the first, you know, round of that. So hospitals are on their agenda there for incentivizing. And then they have implemented they're going to implement strategy to enforce this and make, you know, covered entities accountable. And where that comes into play is making these CPGs a part of the HIPAA security rule. So in that light, that would mean that as I do security risk assessments, I would be assessing against all of those safeguards I showed you at the beginning of this presentation, but also I would be assessing against these CPGs, or cybersecurity performance goals, which that's really the part that I'm the most excited about. And then expanding and maturing a one-stop shop for resources. And so one of those resources is that HHS 405D website that I showed you earlier for education and awareness. And they also post news and updates for HIPAA security on there as well. So those were the 4 main objectives mentioned in this strategy paper. And again, for us as covered entities, where I think this affects us the most is these are the essential goals and the enhanced goals that they've released. Again, these are voluntary, but as they've stated, these essential goals will eventually, I don't know when, I hope it's this year, but it could be next year. These essential goals will be required standards as part of the HIPAA security rule. And so those essential goals, just quickly, mitigating known vulnerabilities. So now not only are you having a risk assessment done, but you will have to show your documentation and have a policy written around how you're going to incorporate that into your security risk management program. And so documenting how you mitigate the known vulnerabilities that came up in your assessment. Email security. Most of my clients are in a much better place than they were even 4 or 5 years ago with email security, multi-factor authentication included. I have a lot of clients who are using 2FA, but that is one of the goals that they're hoping, that all organizations are doing multi-factor authentication. And I want to have more discussions around that, Colin, someday, because I see it being done different ways, but the importance of 2FA on external, but also internally, and get your thoughts on that. We're probably out of time today for a conversation about that. I'm sure you have a lot of good insight. And Ryan, I'm sure you've seen, a lot of that being done with organizations that you've worked with, them trying to figure out like, okay, how do we get started and how far do we take this 2FA? The basic cybersecurity training. So again, we've talked about the training, so making sure that cybersecurity is part of our training. And I do think that the organizations I've been working with are doing much better with incorporating more content and doing it ongoing. But again, this is something that we will begin assessing against. And then strong encryption, revoking those credentials. So we're back to that access and management piece that we ended up with a few minutes ago, revoking those credentials for departing workforce members, including employees, contractors, affiliates, and volunteers. Going back to that conversation we just had, the access management piece is a big part of this. And you see these little links underneath each one of these goals. What I love that they've done a great job with is when you click on each one of these sections, like for instance, the 3MB and the 3MC, HHS has done a great job. They've worked with NIST and other security councils in creating all the information that you want to know when it comes to implementing these performance goals, definitions, guidance, much better than the actual HIPAA security rule itself. So I was very excited that they took the time to really provide very good details on implementing these specifications. And then again, basic incident planning and preparedness. We talked about that. We've, templates we have that we can share, and then unique credentials. For the most part, everybody's using, unique credentials, but I still see those generic IDs, and I still get the pushback on why they're using those. But there's going to come a time when generic user IDs are not going to be acceptable. And there are breaches out there that you can read about on OCR's website that were caused directly from generic user accounts. Separate user and privileged accounts, and then vendor supplier cybersecurity requirements. And Colin, we talked a little bit about that. You showed some that you guys have some videos on the CISA website some training videos surrounding this very topic. So it'll be interesting to watch those and get some more information on these. So these are the cybersecurity performance goals in a nutshell. You have the essential ones. I read the essential ones off because those are the ones that I believe will become a part of the HIPAA security rule pretty soon. And then you have the enhanced goals. And somewhere down the road, I believe those enhanced goals will become required too, but they'll start with the essentials. So I encourage you to go out and find on HHS's website, you can find a listing of these goals, or I can share the list with you. And I have been sharing these with each client as I go through the security risk assessment, but more to come on those and a lot more learning and education around those as well. We're just in the beginning phases of those. And then this is the HHS website, the HPH Cybersecurity Gateway. This is one of their initiatives for having the one-stop shop for everything that you need to know, education-wise, the news release, the updates. The 405D website actually is a link from within this website. So it's hphcyber.hhs.gov, and this is the one-stop shop that they are continuing to build up for all things cybersecurity as it relates to HIPAA. And I believe with that, it brings me to the end of the webinar. I want to say a special thanks to both Ryan and Colin for hopping on and doing this webinar with me. I love collaborating with you guys. I do consider you guys the cybersecurity expert piece of this, where when I want to know, really the inner workings of how things work and what's the best way to mitigate certain things, you guys always give me the best advice, and I love sharing your all's emails and phone numbers. You guys are great with the clients that I work with and being available for providing resources to our clients. So I want to thank you for that as well. And before I end the webinar, is there anything either of you would like to share?
Just real quick, and it's a shout out for two things.
Yeah.
And I'm going to share my screen super quick.
Yeah.
Let's see if we can get this to work one more time. And you may have to stop sharing it, Amy.
Oh, go ahead. I think it's working.
Okay. So vulnerability management is still a nightmare for a lot of folks. I think I was looking at something. There's been 200,000 some odd vulnerabilities over the past 10 or 15 years. So the smart folks at CISA headquarters have come up with a known exploited vulnerabilities catalog. These are vulnerabilities that we know are being exploited by cyber criminals, ransomware actors, and everybody else in between. You get an update about once or twice a week. It's not terrible. You may see some old vulnerabilities, this 2017 one, but I encourage everybody to subscribe to it. It's down at the bottom. And when something gets added to it, you get it to your email inbox. And then it's something that needs to be patched as soon as you can. Obviously, if you're a Microsoft shop, then you can ignore the Apple ones and vice versa. If you're a Cisco shop, you can ignore, whichever other vendor you're using. But subscribing to this and patching these vulnerabilities is one of the best things you can do. And hand in hand with that, and let's see if I can make this thing work super quick. I just had it, is our external vulnerability scanning program. No cost, no contract, data is protected, and it's just scanning your external IP space. We're not going to see into your environment, purely external, but it'll let you know if anything that's public facing has a vulnerability, or even if there's something out there that's public facing you didn't know about, it'll alert you to that. It's a continuous scan pretty much, and then you get a weekly report from it. It's 2 forms to fill out, very easy to get signed up for, and then it just runs and you get that weekly email. Very simple process, but it keeps you aware of any vulnerabilities that are publicly exposed and then anything else that you have on the internet. Both really good programs, and we encourage everybody to sign up for them. Again, no cost, your data is protected, and we don't share any of your data. We're not going to share it with HHS or anybody like that. So really good programs. We would love everybody to sign up for everything.
Yes,
Thanks,
and
Amy.
yeah, thank you for sharing that. And those are great resources. And we do talk about vulnerability scanning. I always ask if clients are scanning. So take advantage of that free vulnerability scan. I want to also point out that at the REC, we also have vulnerability scanning as a service. We do internal vulnerability scans, so a little bit different than what CISA has. But what I say is you can't do as many vulnerability scans as you have the resources to do. More than once a year is great. You know, at a minimum, try to do something yearly. Wouldn't you agree, Colin and Ryan? Try to do that at least annually. But if you've got the resources, take advantage of having it done, you know, a couple times a year. And so also at the REC, you know, if you need help doing the security risk assessment, that's what we're here for. I always think, and I used to work in healthcare organization in the IT department, and we would try to do our SRAs internally, and you can do that. And there's nothing saying that that's not a great idea, but I also think that an extra set of eyes looking at your HIPAA compliance program goes a long way. There are things that external vendors can help you find that sometimes just aren't as glaring when you're right in the middle of it, working with it day to day. So the SRA is what we would love to work with you on, along with the vulnerability scanning. And then this here also on the screen shows you what other services the Kentucky REC has available. So at any time, reach out and ask for more information about any of these programs that maybe could help you in your organization. Again, thank you, Colin and Ryan. Appreciate so much. I thought that we would be able to get this done quickly, but I should have known that when the three of us get together, we have a lot to talk about. And so maybe in the future, we'll address some of those cyber security performance goals and jump into those and look at the actual specifics on how to get those implemented. That might make for our next good webinar together. Thanks again. Have a great day.
Yeah.
And this recording will be shared on our website and also our YouTube channel. All right. Have a great summer.